those two kind of are connected.
How do you, if there's somebody listening right now, they're diabetic, how can they get off the medicine? Because I heard that the doctor makes $800,000, they make a lot, $300,000 a year off you just on being diabetic. Is that not right?
That's correct.
And
You are an
need to change
ATM.
if you want to
When you have diabetes, Pastor, you're an ATM machine for your doctor. Push the button, money comes out.
So how do we reverse it?
Okay. Type 2 diabetes makes up 98% of the diabetic population. Type 1 is about 2%. Type 2 is very simple nutritional deficiency disease. We've known it for 85 years.
What is it then?
Well, I can't tell you. Because people make the mistake that they don't take the whole program. They just try to take that one secret nutrient, and then they kill themselves. Okay, you have to take the whole package. It's kind of like grandma's cake recipe. You just can't take the vanilla extract. You need to take the whole recipe.
Well, what do I need to take? Somebody listen, they want to be
type 2
diabetic. I
diabetic.
got some good friends that are diabetic.
Okay. Well, a diabetic needs the 90 essential nutrients, 60 minerals, 16 vitamins, 12 amino acids, 3 fatty acids. But there's one of them that's missing, or at least significantly reduced when you have type 2 diabetes. So what you have to do is take what we call the healthy blood sugar pack. I mean, that's pretty simple, blood sugar pack for diabetes. And it has all 90 essential nutrients with extra of that one that's missing or reduced. And you take it twice a day based on body weight. And a big fellow like you, what do you weigh, 220, 230?
I wish I was that light. I'm a little thick, but I'm working on it, bro. I'm about 240.
Okay. So say 220, 240, somewhere in there. You would take 2 healthy blood sugar packs per month, a full dose for everything at breakfast and dinner time, and check your fasting blood sugar in the morning before you take your medication, and your blood sugar will drop.
Now wait a minute, Dr. Wallach. This ain't gonna mess up the people's medicine. I talked to a lady. Well, I
hope it
take
does.
my medicine, but it won't. It's okay to take it because your stuff's all natural, and you make it yourself, right?
Yeah.
Not yourself, but you got a company.
Pastor. Now, what happens is, type 2 diabetes is, if you have to have a disease, I'd pick that one. Because the doctor gives you permission to test yourself every day. Okay. In fact, he instructs you to test yourself every day. And the doses of medication you're going to take is based on your blood sugar levels, right? Because the doctor thinks type 2 diabetes is genetic and that it is your blood sugar problem. The blood sugar is just a side effect. It's the same as pain and arthritis. Pain is not arthritis, but it's a side effect of arthritis.
So
it's
if they take the supplemental pack that you offer, and do they have to change their diet?
Oh, absolutely.
What do they got to do?
Well, they got to get rid of the bad stuff, all the inflammatory things, fried foods, processed meats, oils.
Oh, no more Popeyes. Stop. No, out.
Well, do you know, Pastor, just a little quick aside here, Georgetown University did a study 3 years ago on the average lifespan of pastors and priests in America. Do you know what the average lifespan is?
What is
63.
Lord
Half of what the good
I
Lord.
got 3 more years, man. I'm going to heaven quick. I'm in good shape, though, ain't it, bro? I'm taking your stuff. I'm working out every day. I mean, I ain't ready to go yet.
Well, see, it doesn't matter how fit you look or feel. What happens is inflammation inside your arteries based on eating all that fried chicken after service every Sunday. Everybody loves you. They bring you fried chicken from 18 different companies, you know. Right. And this causes inflammation in your arteries and sets you up for blood clots and heart attacks.
How much does that cost? Somebody listen down bad. How much does it cost, that pack?
Okay, for a 200-pound person, it's going to cost you about $7 a day. Cheaper than a cheap of exotic coffee.
How long does it take for it to be?
Well, it depends. If you're good about getting rid of all the bad foods, if you do the diet perfectly, I've had people who have been brittle diabetics for 20 years. They've gone blind. They have heart disease. They've had their feet amputated from all the side effects of the diabetes. And we get them on the program in 2 weeks' time. They're not a diabetic anymore.
You need to call right now, Facebook Live. You holler at your boy. Listen, 708-677-5553. Text me so I can get Dr. Wallach to answer these questions. Another thing I want to ask you, I run into tons of people that's a silent killer. They call it high blood pressure. What do you have with your company that can you can reverse?
Oh, yeah.
You teach that 95% of every disease we got can be reversed. I don't care what it is.
That's correct.
And you've done the research, right?
That's correct. Well,
so how do we reverse high blood pressure?
My book, my thesis for my postdoctoral fellowship in pathology, which is kind of like a PhD, is in the Smithsonian Institute as a national treasure because of that. Does your doctor have a book in the Smithsonian Institute as a national treasure? Because I'll show you how to eliminate 900 different diseases, Pastor. 900.
Wow.
Is based on 20,000 autopsies that I did.
So you didn't just come up with this. You've done research, data.
Yes.
And this is how you come up with the thesis of your
That's
argument.
correct.
So to reverse high blood pressure, what do they got to do?
Okay, it's very simple. High blood pressure, first of all, is not genetic in the black community.
Well, I thought
repeat
most
that.
black people got high blood pressure.
Well, the theory is that it's a genetic disease in the black community, but it's not. The reason why they say that is, well, I don't have to worry about figuring out the problem because it's genetics, it's your problem, and we can give you some medicine to kind of work on controlling your blood pressure, but eventually it's going to get you. Well, that's not true. It is not a genetic disease. That's a false theory. That's like saying there's a little god sitting on Venus up there, and you don't want to tick them off because they'll give you a plague, right? And that's a false theory. Same thing, that high blood pressure is genetic in the black community. That's not true.
They had my mother on Coumadin, and you know what the doctor told me? He told me as soon as she started bleeding to bring her in. I said, well, what do I need to bring her to you for? Coumadin, when I looked it up, is rat poison.
That's correct.
So if you're taking rat poison that's high blood pressure, eventually you're going to have a problem, right?
Well, that doctor should be put in jail. Coumadin is not the proper treatment, even in medical.
So what can they take to get the high
Okay.
blood pressure from your company? Somebody listening right now want to find out what.
Okay, what we're going to do is we're going to support healthy blood pressure and eliminate the cause of the high blood pressure, okay? Two things you got to do. Number one, change the diet. No fried foods, no processed meats, no oils, no glutens. Always the same. Got to get rid of those 4 categories of foods. Stop all the inflammation in the blood vessels. And then you need to supplement with what we call the Healthy Brain and Heart Pack. The Healthy Brain and Heart Pack. Again, 220 pounds or so. Be 2 Healthy Brain and Heart Packs a month, the full dose thing twice a day. But the secret sauce now, that's the basic program. The secret sauce is what we call the Ultimate Daily Classic Tablets. Ultimate Daily Classic Tablets. And I would go ahead and you should take 9 a day, 3 at breakfast, 3 at lunch, 3 at dinner. And that's going to support healthy blood pressure and actually support healthy blood flow, even through 98% obstructed arteries with plaque. It'll get blood flowing through there easy.
Now, one other question. I had one lady, I was in Denver, and I don't know how much time we got. Are we 23 minutes? I don't know. We got a little bit more time. Okay, but listen. She wanted to get her hip replaced. And the doctor said, well, I'm going to replace your hip, but then after that, I'm probably going to have to do your next one. Can you stop people from getting hip replacements?
Oh,
And
absolutely.
What do you think about that?
Oh, absolutely. I can regrow the cartilage in their hips and their knees and their neck and their disc between their vertebrae. We do this all the time. We deal with special forces guys, Navy SEALs that have impact injuries. We deal with people of all ages that have degenerative disease and no cartilage in their knees or their hips. Their degenerative disc disease, they've shrunken 5 inches because all their discs are getting thinner. They have all these various terrible side effects. And so again, what they need to do is get rid of all the bad stuff, no fried foods, no processed meats, no oils, no glutens. And then you throw in the Healthy Bone and Joint Pack. Healthy Bone and Joint Pack. And then there's 2 other things you got to throw in as a little secret sauce. One is vitamin D3, okay? You got either a spray liquid or a capsule. And then another secret sauce is what we call MSM. It's a sulfur compound which provides nutrients that are necessary for tendons and ligaments and cartilage and bone to maintain themselves. And so we're very, very proud of that. And it works like a charm. Again, I take people with bone and arthritis. Andy Young, in fact, Andy Young from the Civil Rights Movement.
Andy Young?
Yeah. He had bone and arthritis, and he was very interested in my sickle cell anemia research because I showed it wasn't a genetic disease. It was a simple birth defect that could be prevented.
You can reverse sickle cell?
Well, I can prevent it, and I can certainly treat it much better than they do with medication. And Andy Young called me because he read my paper when he was ambassador to the UN. He said, this is Ambassador Andy Young. I said, oh, well, thank you, sir, for calling. Well, how can I help you? He said, well, I read your paper on sickle cell anemia, and what you're saying is we could go to tribal Africa, we could go to all these young women who are in the childbearing years, give them your supplement program, and there'll be no more sickle cell anemia. I said, yes, Mr. Ambassador, that is correct. He got so excited, and he called me to his house. I actually flew from California to his house and spent a lot of time with him right there in Atlanta. And I had noticed he was limping. And I said, Mr. Ambassador, why are you limping? He said, well, I got bone-to-bone arthritis in both knees, and Emory University got me scheduled in 2 weeks to do a double knee replacement.
To replace this? I get so many people knee replaced hip, and then they have to get the other one replaced.
Yeah. And so he was going to get both of them done at one time. So he said, sir, it's kind of dangerous, and you could be killed with the anesthesia or something, and you're too valuable. Why don't you give me 90 days, and let me see if I can't rebuild your cartilage. He says, well, they say they can't rebuild cartilage. I said, that's true. They can't. I can. And so I said, just tell them you have, you're an ambassador. You got stuff to do for 90 days. You'll come back and you'll contact them, talk about it again. And so he said, okay. He gave me 90 days. And I rebuilt his knees. Now he plays golf, and he just is perfect. No problem. And this is 25 years later.
Wow.
Now, and he's in great shape. And so I was able to rebuild his cartilage, and we became good friends, and he started introducing me to people. In fact, he was the one who introduced me to Evander Holyfield, and people like Coretta Scott King and stuff like that. He introduced me to.
You work with all them people.
Oh, yes.
Well, I had another lady, too. I want to ask you one other question, too, about high blood pressure. We can reverse that.
Yes.
Diabetes, we can reverse that.
That's correct.
Any disease or anything that you have can be reversed if you just use
The 90,
right?
the mighty 90, and it's for life. That's our motto, 90 for life, not for 2 weeks.
You gotta give me one of them hats,
okay,
bro.
we'll get you
What's
one.
up,
We'll
bro?
get you one. Okay.
right,
And 90 for life, not 90 until you feel better,
Right.
right? And it's 60 minerals, 16 vitamins, 12 amino acids, 3 fatty acids, pasture, all vertebrates. Now, God is very clever. God is very clever. You know that.
Right.
Now, he found a good system, and he used it on all vertebrates, whether you're a giraffe or a flamingo or a human being or a porpoise or a fish or a turtle, a rabbit, a pig, an elephant, doesn't matter. If you are a vertebrate, anytime you have the same deficiency, you're going to get the same disease. I'm finding sickle cell anemia in hummingbirds and deer and African antelope. I'm finding type 2 diabetes in alligators and crocodiles.
Wow.
And so that taught me. I'm just a kid. But it taught me that there's some universal principles. You're deficient in this nutrient, no matter what species you are. If you're a vertebrate, you're going to get the same disease.
Listen, we've got to go, but you have got to stay right here. We're going to hear from Dr. Wallach. We've got some other things we're going to talk to him about. We got an exciting guest coming up next. We're going to hear that salt is good for you.
Oh,
Well,
sir.
everything the doctor say, you say opposite.
Salt your food to taste.
Salt
When it
is
tastes good, pasture, triple it.
Listen, don't leave. I'll be right back with Unlimited Access with Dr. Joe Wallach.